Thank you very much, Bernard and team. As Bernard has shared, we're doing an introduction of Ushauri, how to be able to use the system, and after my introduction, the system, then Ron will be able to do a walkthrough of the actual system and be able to expect feedback and have interaction. So next slide. Yeah. So this is the outline of the presentation. Is that the Ushauri is actually a mobile application and was originally developed and managed by mHealth Kenya. And as Bernard has shared with you, this portfolio is currently being managed by Palladium through ETAC under Kenya HMIS3, and it actually consists a portfolio of 6 apps. So today we're just looking at one application, that is Ushauri. Next slide. So these are the 6 apps that the applications that consist the mHealth portfolio. So we have Ushauri that handles the application diary. We have the C4C. We have mLab. We have Ushauri. We have the ART directory, and last but not least, we have the P survey. So in the near future, I think we'll be able to look at all these applications. But for today, the focus is actually on Ushauri. Next. So Ushauri is a mobile and web-based platform that's developed to improve health outcomes by providing, the goal is actually to provide timely and reliable messages through appointment reminders, treatment adherence messages, and wellness messages. It also provides the care provider with the ability to manage an electronic appointment diary and default tracing aimed at managing the appointments at the facility level. Next. So this is just a simple process flow of Ushauri, where after you're able to go to the facility, the care and treatment team can be able to add a client and book a client for or schedule a client's next appointment after consenting them. So the consented patients are able to receive automatic alerts and reminders on their appointments that are due. We also, stakeholders are also able to get reports based on the KPIs, and which can be used to make policy. As you'll see later on, there's a dashboard that has very interactive data that you can use to make decisions. Next slide. Yeah, these are modules. So we have several modules within Ushauri. As I said, there's the appointment diary that consists the client registration, consenting, appointment booking. You're also able to do transfer in, the clinical movement. We also have defaulter diary where you're able to track missed, defaulted, and lost follow-up. We also have a PMTCT module that has hey registration. We're able to manage hey appointment, mother's appointment, and get the final outcome. We also have differentiated service delivery module where we're able also to schedule the DSD appointments. Next slide. So just looking at the value proposition that Ushauri brings, I'll focus on 4 key ones. So as I'd already mentioned, Ushauri focused on providing appointment. It's actually an electronic appointment diary. So it provides you an opportunity to have timely appointment kept, and as a result, you're able to get adherence where your patients are able to come to keep the appointments through the reminders that the system provides. We're also able to see improved communication between the providers and the patient through the SMS, because that's an interactive system that the providers and the patient are able to interact. We also have access to, gives you an opportunity to have real-time access to appointment schedule, where you can be able to see how many are due for appointment for that particular day and also for any other day. So which gives you efficiency, because real-time access to the appointments, and you'll be able to plan and know who is due for appointment when. Next. Yeah, finally, just towards the journey, I know all of us want to go paperless, so this gives you an opportunity to, through electronic management of appointments, it gives you a step towards the journey to go paperless on electronic management of patients. Next slide. So I just wanted to encourage us, mobile apps is actually the future, and we all use mobile application one place or another. So thank you very much, Bernard. I think we can. Is there, you had something to say? I think, is there unmuted?
Yeah, thank you very much for that introduction. So I think from there we'll just go straight to Ronald to just take us through the application. So Ronald is going to walk us through the application from A to Z. Should you have any questions while Ronald is making his presentation, kindly just type it in the chat area. We'll be able to respond to it as we go along. Thanks. I don't know if Ronald, you are on.
Yes, I'm on. So thank you, host, and good afternoon, everyone. So I'll just do a walkthrough the Ushauri application, both the mobile and the web dashboard. So I hope this is going to be an interactive walkthrough session. So let me just share out my screen so that we can begin. All right, so somebody to confirm if the screen is visible before we start.
Yes, it is visible.
Okay. So Ushauri basically, as the previous presenter said, is just majorly to manage the appointments of our clients at the site level. So the first thing, to get the Ushauri, you go to Google Play Store and type the Ushauri V2, the one you see on your screen. Then after downloading, you just open it. Then it will take you to the landing page, which is for the login page, and where you can now create an account. Yeah. So the first thing which usually happens, so a clinician or a clinician at the facility, they provide the phone number which should be mapped to that particular facility, and the phone number is also mapped to a clinic. Yeah. So the Ushauri app is a clinic based. So you can only operate clients who are under your clinic. And in any case, maybe a client is moving from one clinic to another, you can as well do the clinic movement so that you can manage your client at your comfort. So the first thing, after your phone number has been mapped to your facility and the clinic, so you just go to the create one and create account. So of course it will take you to that page of the terms and conditions, which you should read to the last digit. Then you accept. Then after that, it will take you to now the creation account page. So you will use the phone number which has been mapped to your facility and create the account. Yeah. So the page just consists of the normal registration, but the key indicator here is the phone number, because the system will check whether this phone number is already mapped to a facility, so that it will pull for you the details of your clients when you are now doing the bookings and so on. So the first thing, you just input the phone number. Of course, I've created an account, but I'll just walk you through this and see the process. Yeah. So you just create account using the phone number. Let me just use mine now. Then now you will select the affiliate, which affiliation is attached to your facility. For my case, because this is a training session, we'll be using a training partner. Then now you put the username, password, and then security int and those security questions. So I'll not create account because I've already created one. I just wanted us to see that process of the account creation. So remember, the phone number is the key indicator, and the phone number has to be mapped to a facility for you now to start the process of using the application. So I'll just log in. First, I'll go through the PSC or the CCC clinic. Then I'll walk through the PMTCT, because those are two unique clinics. So I'll log in as a CCC clinic user. All right, so there we go. So that's the landing page. So the page consists of some cards there. And those tabs, we have the appointment management. So at that point, you will be doing your daily appointment management of your client. Then the next one, we have the defaulter diary. So the defaulter diary is just to help you manage or get the clients who have defaulted their appointment. Yeah. So under that service point, you will be getting the clients who have defaulted. Then the next tab is for the PMTCT. So that's a module where you will be managing your PMTCT clients and attach them to, of course, to their HEI. Then the other one is mLab. That one is just taking you to the mLab application. Then the web dashboard, that one will redirect you to the web dashboard. Then the next one is the wellness. Yeah. So wellness is just all about if the client was sent like a wellness message. If they respond to the wellness message, you will be able to see that on that particular dashboard. Then the last one is to reschedule appointment. So we have several icons there. So what I did, I went to the appointment diary, and it has several modules. Let me call it so. So the first one is for the registration, the one with the like. One is for the DSD, the differentiated clients. Then the other one is for now the transit. Then we have the clinic movement and
Hi, Victor. I think your network is breaking.
As we wait for him, I can see there are 2 hands raised up. Could we probably take questions if there are questions or concerns from the 2 hands? Bonga, Akelo, and Kimani, probably.
Yes, let me give Kimani a mic. Yes, Kimani. Can you unmute and proceed?
Bernard is coming back in a few.
Okay. That's fine. So Kimani, I've already given you a mic. I don't know if you have a question or a comment. Your hand is up.
Can you hear me now?
Yes.
Okay. Some of my team members are waiting on the lounge, so maybe somebody can keep on checking to let them in. And then just another thing besides that, when Ronnie began by downloading the application and went ahead to do the registration. I think something that wasn't very clear was any person can register, or there is a requirement for somebody to use that particular application. Maybe if that can be, that clarity might be put across so that even members who have joined in can really understand, because I know there are guys who are trying to log in into the app and they're not able to go through. So maybe any clarification on that.
Thank you. Thank you for that. Yeah, so I think if I had from the presentation, if you had it correctly, you clearly said that the key indicator there is your phone number, and that phone number has to be mapped to a facility. So your phone number has to be mapped to a facility for you to be able to create an account and log in. And then when you do a login, you'll only be able to interact with the dashboards of the patient that belong to that particular facility. That's assuming that if you are working at the facility level. But then there is a partner that also has a group of facilities, as we are going to see later, that then a partner is able to manage several facilities. But for the facility users, you must have a phone number that is mapped to that particular facility, that particular MFL code, for you to be able to log in.
Yes, Ben. I think you're correct in terms of the mapping, and not everyone can be able to log in until you're mapped to the facility.
Yeah, so there's a question on the chat. I think as we wait for Victor to share the screen, seeking clarity around who does the mapping of the numbers, or how does one go about mapping the numbers. Yeah, I think I want to give that to Victor Were to just give a brief clarity on that.
Yeah. Just like any other system, there are system user controls roles that have been assigned to specific levels. For facilities, the partner can be able to do that. I think when we go to the web app, we'll be able to take you through how that is done. Thank you.
So we'll see that in a moment when we are looking at the dashboard on the web.
So we were walking through now the appointment diary. I'm just sharing in a second. And basically I was now going through I hope it is visible. Let me just relog in again. So under appointment diary, so we were to go through the first one, yeah. So the first one just entails about registration of client, yeah. So the first thing, we have to have a client to exist in a Ushauri application. for us now to manage the journey of this particular client in terms of now appointment booking and default tracing. So that point of registration, so you will now specify how you want to register this client. Is it a new client? Is it a transfer in client, or do you want to update a client? So the transaction type is what will determine on what you want to do with that particular form. So if you select new, so the new, you will now required to register this client in the system, in the sense that the client is not already in the system, yeah? So if you select new, you can see that field of MFL code is already populated, yeah? And so we will now require to just input the 5 other CCC number to make it a 10 complete digit CCC number for the client, because it composed of the 5 digits of the MFL code and the 5 digits of CCC number. Then the other details are like the common details of the client, like the name of the client, the date of birth. So I'll just walk you through this, and you'll see what we capture in the form. So later on, maybe somebody will do that because of interest of time. So we just capture those details. You can see the gender, the marital status. So the patient condition is now the condition which this client is on the treatment. It is on ART or pre-ART. So you specify that. Then the CCC enrollment, when was this client enrolled to CCC? So you specify the date, then the HIV enrollment date. Then the primary phone number is just the phone number of the client. So in any case, this client is going to consent. That's the phone number we'll use to send the reminder out to this particular client. Then to enable SMS, now this is the point of consent. If the client had consented, you say yes. If the client has not consented, you say no. Then the status, this is now like the system status, like is this client active? So you say active, yes. Then the grouping is now which group do this particular client you are registering belongs to. So you select based on the drop down you can see on your screen. Then the other informations are like in any case you want to now drill down to where this particular client is coming from, just for the purpose of maybe tracing also. So county, sub-county, ward and location and village, so that now you can get to the nearest where this client is from, then you submit. So that one was for the new. For the update, so update is like just updating a specific field. Maybe I want to update the phone number of the client. So the key indicator here is the MFL code and the CCC. So once you have input the MFL code and the CCC number, just go straight to that particular field you want to update. Do you want to update the phone number, or do you want to update the client condition, or maybe you want to update the client status? Maybe client has declined not to be registered in Ushauri. So what you can do, you can just disable this particular client, or the client is a deceased, yeah? So you just go straight to that particular field which you want to make an update on. Then you just submit. Then the update will be effected on the system. Then the next transaction type is the transfer in. So for the purpose of this one allows you to transfer in a client from a facility without Ushauri. So why are we using this? So in this case, this client is coming with a new, with a new MFL code, which is not for your facility. but you want to capture this client as your client moving forward. So you will just select the transaction type of transfer in and enroll this client into your facility, because the client details are not in the system anyway, because the facility this client is coming from is not using Ushauri. So you will enroll this client in your facility and capture the details which are on the client's card. So it is just the same form, then you submit the details as required. All right. So the next one is the consenter. So under this, we are now consenting clients who have agreed to receive reminders. So if a client has consented to receive the appointment reminders, this the point, or this the module which will allow you to consent them and set for them a reminder. So the main key indicator here is the mHealth code and CCC number. So you have to input that. And then the consent date, when did this particular client consented? You have to show that. Then the language, yeah. So we have two languages there, Swahili or English. The preferred language of this particular client. So each and every client preferred a language which their message will go out. So you will specify that based on the language which the client has consented to. So the next, in any case, the client also has agreed to receive the motivationals which are going out weekly. You can specify that. Then the next one is now the time, yeah. Each and every client have their preferred time which they want their message to go out. Maybe somebody wants 8 p.m., 9 p.m., 10 p.m. So you will specify a time based on the client agreement. Then of course now the phone number which is being used by the client. So that's the phone number which will be used to send out the reminder for the client. So the reminders are going out, the appointment reminders are going out 7 days to the appointment date and 24 hours to the appointment date. So the client is being reminded in 2 sessions, 1 week 2 and a day 2. So the next one is the appointment booking. So at this point is where you will be booking client. So majorly this point helps you to book client for the first time if the client had never been booked in the system. So of course the key indicators, as I have always said, the mHealth code and CCC number, because this is what is being used to check if the client is in the system or not, to enable you to book this particular client. Then you set the appointment date. Then the appointment type, which kind of appointment is this client going to come for? It is a refill, clinical review, enhanced adherence, lab investigation, of VL booking, or the other. So the other now provide you with an extra field where you can specify an extra appointments which this particular client will be coming for, if it is more than one appointment. So the other, if you select other, there's an extra field there you can see. Then you just write the name of that particular appointment which you want to the client will be coming for. Then the next one is just now to track if the appointment was kept or not. Because you are booking the client for the first time, we'll say this is not applicable because this is the first time you will be booking the client. Okay. So the next one, I'm on the 4th one. The 4th one is where now we manage the DSD clients, yeah. So DSD clients are clients who are stable and can be given the long-term appointment, the month 3 appointment and the month 6 appointment. So the month 3 appointment is the refill, and the month 6 appointment is the clinical review. So at this point, we have 2 ways. So clients who have been on care less than 12 months, so they will be categorized under 2 categories. They are either under advanced or well, and those clients who have been on care or treatment more than 12 months, they are now being considered as categorized as stable or unstable. So depending on the treatment date which the client started their care. So we'll just use a sample and maybe see. Maybe let me see, 1, 2, 3, 4, 5. That's our test MFL code. Let me see if I have a client here. Oh, this is a PSC client. So I think I'm on DSD, and I'm on PMTCT clinic, yeah. Let me just use this. Yes, so you can see it has brought like a stability level. So this client has been on care more than 12 months. So you select whether the client is stable or unstable. So if you select unstable, it means we can't book this client on DSD because the client is unstable and we should not give the client a long-term appointment. So we just give the client the normal appointment with just the single appointment date and the appointment type, as we had seen from the previous appointment module. Then if the client is stable, so this client will now go through the DSD process. So this DSD process asks you to specify whether the client is now on DSD or not. So if the client is on DSD, the next thing is to specify is are you registering this client as new on DSD or continuing? So specify that based on what the client is. Then there are some now models based on this particular DSD. So we have a facility-based or community-based. Where is this client receiving the service? It is the facility or the community. If it is facility, then the facility has some model under them. If it is community, then community also have some model. So for facility, we have the fast track model and the facility-based adherence clubs, yeah. Then if it is community, we have some models as well there. There are several, as you can see on your screen. So based on where this client belongs to, we just select here. Then the last bit is now the refill date, which is for the month 3, and the clinical review date. So because this is a stable client and is a DSD client, we can now book the client with 2 long-term appointments, the refill date and the clinical review date, right? Then you just submit. Okay. So the next one is transfer in client, yeah. So this is another transfer in. The other one, you can, if you can remember, the other one you are transferring a client which is coming from a site which is not using Ushauri, because the details of the clients are not in the system. But this other module now allows you to transfer in a client between facility that have Ushauri system, because the client details are already in the system, but on another facility. So what you will, the system will now just require you to map this client to your facility. And of course, the main key indicator is the mHealth code and the CCC. So you will just input the MFL code which this client is coming with and the CCC number, and all the details of this client will be transferred from that facility X to your parent facility. Okay. So the next one is transit, yeah. So transit module is just basically for those who are on movement, just as the name suggests, the transit, yeah. And basically the service which are being offered to them is majorly the refill, because they just pop into your facility to pick drugs for maybe a specific duration. So you will just capture the MFL code, CCC number, and maybe the ID, because those who are in the border can as well be transit. Those who are moving across the border can as well be transit client. And the number of drugs the client has picked and the duration. Then, of course, now the appointment type is just refill, because we are giving the client drugs for a specific duration. Then you submit. So it is basically for those who are on movement, and the refill is the only appointment type which is being captured under this module. All right. So the next one, is the clinic movement, right? So this basically allows you to move a client from one clinic to the next. So if you maybe CCC clinic has reached a point where they should be at a PMTCT client, you can do that and move them from the general clinic to the CCC. Or adolescent client has moved from that stage to now the PSC clinic. You can as well do that movement. So the key indicators, as I will say, is the MFL code and the CC number. Then now you select which clinic this client is moving to. I think that's all for the appointment diary. So just a second. So the next thing, I just want to show you how we can view today's appointment. How can you get your today's appointment? Unless I'm too fast, somebody can say before I proceed again. Just a second. Moderator, you can confirm if I'm too fast. Or,
I think right.
Okay.
We just have one person which takes the question. So, I think we can just allow one question, then we continue.
Okay.
So, Francis, can you mute and proceed?
Hello, my concern is that we can't see the screen on our end. That's the only concern.
I don't know if it is your network on your side, because I could see the screen all the time. You might want to check. You might want to restart the Teams on your side.
It's okay. Let me try.
Okay.
Okay. So maybe I can proceed now. So this blank page, it gives you the appointment of that particular day.
You may want to share your screen. Your screen is not on.
Okay, sorry. Let me. Oh, I think it is the effect of Francis. I wanted to. Sorry for that. All right. So there we go. So this blank white page is where the list of today's appointment will populate. So let me just log in again. Let me just log in. Okay. So you will be using the pink icon on your right below, just to pull the appointment of that particular day. So if you click on it, it will pull for you the appointment of that particular date and with appointment counter of that particular day. Yeah. So like this, you can see I have like 4 appointments for today for the test purpose. And it will give you like the details of this particular client, the CC number, the name, the appointment type, the phone number, just to check if it is a correct one, the appointment date, and the serial number. In any case, the client has a serial number on their card. So you can see we have some 2 buttons there. We have for confirm and contact client. So for contact client, if you contact the client, it will take you direct to the dial page of the phone, and you can directly call the client if maybe they are getting late to come for the appointment and the appointment is almost due. Then this other button is the confirm. So the confirm button now will allow you to confirm this client and give them the next TCA. So once you have confirmed, the client will be removed from today's appointment because the appointment has been ordered. So if you click confirm on each client, it will give you like a page for you now to book the client for the next appointment, so that this client can be moved out of today's appointment because the appointment has been honored. So you select the appointment type, is just the same as appointment booking. Then in the interest of DSD, if the client is a DSD client, you specify. If not, you say not on DSD. Then now the appointment date. Then you just submit. So you can see the appointment of that particular client has been successful. So if you refresh, you can see the appointment as the appointment count now has decreased to 3, sorry, because there were 4 appointments. Yeah, so that's how you confirm your clients who have an appointment for the day. You just pull, then you confirm and give them the next TCA. So I think that one summarizes the appointment diary as a whole. So the next bit is the defaulter diary. So defaulter diary is basically for those who have missed the appointment and they didn't come for the appointment on the expected date. So they are being pushed to missed, defaulted, or lost to follow-up based on the number of days they have defaulted. For those who have defaulted for more than 24 hours, they are being pushed under missed and then under call section. Then if they have missed more than 3 to 4 days, they are being pushed under home. So then those who have now defaulted more than 5 days, I hope so, 4 days and above, they are being pushed under defaulted. The same to home call and home visit. Then those who have now missed the appointment for more than 30 days, they are being pushed to lost follow-up. So the same as today's appointment, you just use the pink icon just to pull, and the list of those clients who have missed or defaulted will be populated under each. So I think I don't have those who have missed. Under default, I can see I have some. So it's just give you the list of each client and the expected appointment type which they were supposed to come for and the appointment date. So under each client, we have those two buttons, the call and the confirm. The call is just the same one. You can directly call the client from that point, or you confirm the client. If the client came, you can confirm, or maybe if the client decline, you can as well capture that. So if we use this first one as an example, or if you confirm, you specify the date. Specify the date. Then, of course, the DSD, if the client is a DSD or not. Then the outcome. So this is now the interest of tracing of the client. Was the client contacted, or the client was not contacted? The informant contacted or informant not contacted? So the informant is maybe the person who is the immediate person who can be contacted in any case the client cannot be reached. So if you select client not contacted, then what was the final outcome of that? Or if you select client contacted, then what was the final outcome of the contact? Client decline, care, or client return to care, or client self-transfer, or other. So you specify based on the tracing of this particular client. So if the client decline, it means we can't still remove this client from defaulter diary because the client has not agreed to come back to care and be booked again for the next appointment. But if now we select the client return to care, so we are able to book. You can see now we are able to book the client for the next appointment. So you set the date which the client returned to care, let's say today, then maybe the appointment date, the next appointment the client is supposed to come for, then the appointment type, then now the tracer name, who traced this particular client. So suppose I'm the one who did it, and what cost did it cost you to trace this particular client? Maybe say 0 shillings. So if it was 5 bob, you can specify that. Then you just submit, yeah. So you can see the update of the client was successful, and the next appointment of this particular client has been set now. So the client is now no longer not an active defaulted because we have set the next appointment for the client. So the same goes to lost to follow-up. It is just the same thing because we are tracing this client. If you confirm, the outcome will be the client contacted after lost to follow-up, or client not contacted, the informant contacted or not contacted. Then now the same to the final outcome, yeah? The client decline, or the client return to care, or the client decided to be a self-transfer. So those are some of the outcomes which are being captured when you are now tracing the client, yeah? Okay. So I think that's all for the default diary, because the same just apply across the 3 So I can proceed to PMTCT. Yes, so maybe I can do a clinic movement for one client so that we will use that client in PMTCT as an example. 1, 2, 3, 4, 5. So we will use that particular client in PMTCT. So I just wanted to show you how we do the clinic movement so that you see actually we are going to use that same client in PMTCT. So I'll just log in as a PMTCT clinic user because you know it is a clinic based. You can't manage a client who is out of your clinic. So once I've logged in, so the other functionalities remain the same, but now for PMTCT clinic, you will be able to now manage your clients who are under your clinic for the PMTCT. So basically, for PMTCT is just mapping a hay to the mother. So once you have mapped the hay to the mother, you are able to manage them in terms of now appointment and so on. And again, you can map a caregiver. In any case, the hay doesn't have maybe like a mother to take them to the clinic. You can map a caregiver who is able to take them to the clinic. So on the dashboard of PMTCT module, we have those icons you can see there. We have hay registration. You can register a hay. Then caregiver registration of a caregiver. Update of hay, mother appointment, hay appointment, and schedule hay appointment. Then positive PCR, and then the final outcome. So I'll just walk you through all this, and we know so that we can know how this module works here. So under hay registration, we use the CCC number of the mother to check and map hay to this particular mother because the mother is already in the system, and now the next step is now to map a hay who belongs to this particular mother. If they are twins or one or more, you can map each to that particular mother. So we are going to use the CCC number, which we did a clinic movement. Let's see if it allows. Yes. So after that, it now requires you to specify if the mother is breastfeeding or not, or pregnant. Of course, if the mother is if you select pregnant, there's no hay to attach. Yeah? So that's why you can see some other fields there. So if the mother, let's say, is breastfeeding, so we are going to have a form there to fill. The form will contain the details of the hay. So you will just attach a hay to this particular mother. So maybe let's say that way. Then the gender, the date of birth. Let's say the hay was born around some time there. Right. Then we just attach the hay to the mother so that Oh, this area already exists, so you can't do that. Let me see a unique one. This is just a test one. Yeah, that one has gone successful. So once you register the hay, that particular hay will be mapped to the mother. So the next one is the caregiver, yeah? So this is just a caregiver form. You can register caregiver and map a hay to this particular caregiver. So as I had said, caregiver is now someone who is not on treatment, but is responsible for taking the hay to the clinic, yeah? So you just capture the details of the caregiver. So the phone number of that caregiver is what may be used to send the reminder for the caregiver to maybe bring the hay for the appointment when the appointment is due. So it is just a form for the caregiver details and the same form of capturing the hay details, the hay number and date of birth and the names and the gender, of course. Right? So the next one is just updating the hay details. So you just use the hay number and to search. Then the fields will be auto-filled. So you just go straight to which field you want to update. Then you submit. Then the next one is now the paired mother-child appointment. You can give them appointment. So you can see it's bringing for us the hay which we had mapped to this particular mother, so that we give them a paired appointment. So
yeah, I think Ronald is having an issue with the network. Let me just follow up. In the meantime, as he reconnects, I think we have a number of questions in the chat area, which I think we can look at briefly. Let me see. So there is a question asking about what happens in a situation a client changes the phone number. Is there an option for editing the records? And I think it's sufficiently answered. Is you're able to at the facility they are able to edit the patient details and update the client phone number. The other question is there a way of migrating the contact details from the email as opposed to typing it again? Yeah, I think this one has been sufficiently responded to by Cynthia, where I think she has said that there is a query that can easily migrate this. But again, there's the process of consenting, which has to take place, where the clients have to be consented for them to be receiving the messages. Let me look for another one. No, there is a question that was asking about somebody did not understand the procedure of pulling PMTCT client from general population. I think somebody didn't understand that. But I think in the interest of time, because we are at 3:23, I just want to recap that briefly before we proceed.
okay. So I think I'm audible. So what was the question? Just come up a bit before I proceed.
Now, somebody's asking, we didn't understand the procedure of pulling TMTCT from general population.
Okay, so for you to, maybe if the client was in the general population, you do the clinic movement as I did from the other end. So you just move the client from the general population to a PMTCT clinic by just inputting the, let me just show you from that module where you do that. Here at this point, yeah. So you do the clinic movement, MFL code and the CCC number. Then you just select the clinic, which is the PMTCT, of course. Then the client will be moved to the PMTCT module. All right, so I think we were under the unscheduled. So the unscheduled, as I said, is all about maybe if the hay was brought to the clinic before the appointment date. So the system will be flexible for you to book them before the appointment date reaches. So at this point is where you can do that and give them the next appointment. The next one is the positive PCR enrollment. So in any case, hay turns positive, yeah? You can enroll them as a positive PCR. So you just use the hay number and as such, then it will give you.
Yeah, so I think the question around the merging Kenya and Ushauri, I think that has been adequately answered. There is an interoperability layer that actually seamlessly exchange data between Ushauri and Kenya EMR. So you don't really need to, you really don't need to, you don't need to make entries in two places as long as the configurations are right. So I think I can see Ronald is back. Ronald, please confirm if you have the mic.
Yeah, I think somebody is like kicking me off every time, so I don't know what is going on, but it's okay.
Yeah, whoever it is, we kindly ask you to relax. Let Ronald finish up.
Okay. So we were at the final outcome. Yes, so we were. So final outcome is just specify what was the final outcome of this particular hay. If the hay has finished the 24 months period, the hay can be transferred out of the clinic. So you just select the final outcome. Based on this particular hay.
Ronald, we've lost your screen.
Okay, just a second. So basically, the final outcome is just, I'm just connecting. The final outcome is just basically stating what this particular hay has gone through the process, yeah? So if the hay has completed the 24 months period,
Ronald,
we are able
still can,
to.
You cannot see your screen still. I don't know
I'm
if
there,
you have your screen.
I'm there.
Oh, okay. You're
Yeah.
back. So I don't know if you want to summarize the app so that we can go to the web, just in the interest of time.
Yeah, this was the last bit. So those are the final outcomes I was talking about. Whether the hay is deceased, lost follow-up, or transfer out. So it will depend on whether the hay has completed the 24 months period or the hay is still within the 24 months period of care. So I think that was the final one as the final outcome about PMTCT module. Then the other one is just the reschedule appointment. You can reschedule appointment, just the same thing. You use the CCC number or the hay number to check. Then the details of that particular appointment of the client will be populated on the screen. Then you can reschedule the appointment based on the date which you want to reschedule that appointment to be. Then I think that's all for the app, unless there is a comment before we embark now on the dashboard.
I think let's just proceed to the dashboard. We are answering the questions on the chat section. So maybe we'll allow for questions at the end of it, just because of time. But should anyone ask a question, please just type it on the chat area. We'll be able to respond. Thanks.
Okay, so let me just now reshare my screen again so that we move to the dashboard. I guess it is visible. All right, so I'll just show you how now all those data we were capturing under the mobile app on the dashboard, yeah? So you use the number which was register under your facility or the email to log in once you have created the password. So if I log in on the facility level, this is a test facility. So this is the dashboard, and that's the landing page, yeah? So the landing page has just like the number of clients you have for your facility, those who have consented, the appointments which have been created in your facility, and the messages which have been sent out, yeah? So below there, we have the line list you can pull the line list for the today's appointment, missed appointment, as you can see from those tabs. Then we have also the faulted client and the lost follow-up. So these are just line lists for those who are still like active. Defaulted means they have not been confirmed and given the next appointment, or they are still a lost follow-up and they have no next TCA. The same to missed. So on the navigation bar on your left, you have some drop downs there. So for the client, I'll just go through some because it is much details. So under the client, we have a client profile. So under client profile, you are just able to search a particular client and see the client journey starting from the registration and moving forward up to the appointment outcome. Yeah? So if you search one client, let me just search one just in interest of time, just to see the outcome of that particular client. So if you search the particular client, it will give you the registration details of the client. You can see from the first tab, the profile, then now the appointment journey. I think this client has never been booked. So let me just use another one. But it will give you the total counts for each to see how the client has been performing. Then the next tab is for just outgoing messages, the messages which have been going out for that particular client. Then in any case, the client responded, that one also will be populated there, the wellness as well, then the appointment outcomes. If there was an outcome, or in terms of now tracing what was the outcome and the final outcomes, the ones we were capturing under the defaulted diary. So that one will be populated there in that line list. So the next one, I think I can go through the non-consent. Yes, the non-consent. So this is just giving you a list of clients who are not consented to receive messages. And in any case, now you want to consent them. This point, it now can allow you to consent them now to receive the messages. So you just drill down and consent the client. So it is just the same form which we show on the mobile app. You select if the client has consented, the date, the language, and the preferred time. So it is just the same thing, but it has now been extended to the web. The client, this is just a list, a line list for the client. So you can pull a line list of your client for your facility from that point. So I'll just be mentioning them. Then the next one is the appointment diary. So under appointment diary, we have the future appointment. Yeah, future appointment, you can get a list of clients who have a future appointment at your facility and do some decision based on what you want to do. Under defaulted diary, you have the missed defaulted. Those are just line list for based on those. Then edit appointment, you can edit appointment from this point. Yes, then we have the calendar. Let me just show you the calendar. I think that's what is unique here. So for the calendar is just showing you the number of appointment you have for a particular day. So you can see for each day, there's appointment which is pegged on each day, the total number of appointment, and based on the appointment type. So you can know today you have those who are coming for refill are 2, those who may be coming for clinical review also, and such a number. So you can decide and manage the appointment of your client for a particular day. Then wellness, these are also just line list based on the response from the client. Groupings, also line list based on the groups of clients. So those who are in adolescent, you can pull that line list, same to PMTCT and so on. Then the tracing, we have a client tracing here. So for this one, it like give you, this is a point where you can book, once a client has been booked, yeah, you can assign somebody who can trace them. In any case, they come a defaulter for that particular appointment. So this one will book, will like pull the clients who have future appointment, and they can now be assigned to a tracer. So you can see that button of assigning under each client. So once you click that, you can now assign a client to a tracer. So it will give you a drop down of tracers who have been registered under that facility or site, so that they are responsible for tracing the client. So that one can be done. And now below it, I think now we have a list. This one now will give you a list of clients who have been signed to specific tracers, yeah, and the appointment date, and maybe the appointment status of that particular client, yeah. So from that list, you can see that. Then the other ones are like the DSD. DSD is just a line list for clients who are under DSD. Then the PMTCT as well, also like it is the summary is a chart for clients who are on PMTCT, and based on aging, yeah, and the appointment behavior for those particular clients who are under PMTCT. Then the HEI also as well. So we just captured the list of HEI. So you can pull the list of HEI under your facility. Then the appointment diary is just an appointment behavior for the particular HEI, the default diary as well. Then the final outcome now will be a line list based on the outcome, those who are deceased, those who are transferred out, or those who have finished the period for the 24-month period as a HEI. Then the final one is the reports. So the reports is just give us several reports based on several actions which we do in the system. So these are just line lists which you can pull. If you can want to pull the clients who are deactivated, the today's appointment, the consented client, monthly and today's appointment summary report, and tracing outcome. So tracing outcome will now just give you a report based on clients who have been traced and with their specific tracing outcome. I think I will try to be a little bit, not fast, but being understood. So thanks, and maybe we can now open up for questions at this point. Moderator.
Thank you, Ronald. Thank you for that walkthrough. So I think we are at 3:41, so we still have some time. We can respond to questions. So if you have any question to Ronald, please just raise up your hand and I'll give you a mic. Meanwhile, let me see some questions in there. How is one able to get the credentials to access the web dashboard? That's a question in the chat area. Let me see who has the hands up. Dan Muchi. Dan, kindly unmute and proceed and ask your question.
Hello, how are you? Thank you, Ronald, for the good presentation. I was just asking, as Kenya EMR usually has a dummy platform where you can be able to do a demonstration for training purposes. Does Ushauri also have a dummy application or a URL link that you can be able to use for demonstrations and also for purposes of capacity enhancement prior to having access to the real application? Secondly, a question on PrEP uptake and PrEP clients. Are they also a model under Ushauri? Then my last point was on how to be able to install. Is this application only based on Android apps, or can it also be installed in other applications? Over.
Thank you. Thank you very much, Dan. I think we have noted those two questions. I can't see any other hand unless I really can't see another hand. So I think we'll begin with the first question around do we have demonstration site for Ushauri? Yeah, that's a question to Ronald.
Okay, I think I can take it up.
Okay.
So for Ushauri, we have a demo account for maybe if you want to access a facility. So we have a test facility which we use for training purposes. So we can like provide the credential for that, so that you can play around with the credentials for the test purposes for the demo.
Yeah, then there was a question around whether it's possible to install Ushauri on a different platform other than Android. Can you install it on iOS, Apple?
So at this point, I think Ushauri is only running under Android. It is Android based. So this came out because majority of the users at the facility are using the Android. So yes, it is only running at Android application at the moment.
Thanks. I think that is very clear. Let me see.
Then the next one was about the PrEP clients, yeah?
Yes.
So I think for PrEP clients, there is when I was presenting there was a point where you select whether they are on ART or they are on pre-ART. So yes, Ushauri capture both those who are on ART and those who are on pre-ART. Is that well answered?
Yes, I think that is well answered. And I think also for the team, just posted the user manual for the application. You can access it on our website on the links that has been provided. Let me see, I'm seeing another hand. This is from Obumba Dispensary. Please unmute and ask the question.
I have a question concerning registration of clients. How the dialogue of local languages registering clients. And another question, the second, DC clients. While registering a DC client, the client has 2 days for refill and for clinical review. While the client comes for picking, already the client was already booked in Ushauri, and while trying to book the client for clinical review, can you assist there?
I don't know if it is your network. You are not very clear, so I think I've only understood the first question. Your second question I couldn't get. You are asking whether does the Ushauri allow use of any other language during registration other than the ones provided?
Yes.
I don't know if I got you right.
Yes.
Yes, Ronald.
Okay, so basically, Ushauri is running on 2 languages, the Swahili and English. So those are the languages which were regulated by NASCOP. Maybe the discussion of including the local languages will be like in the process of taking up, so that all the local languages can be included in the system. Yes, they can be included, it is possible, but for now it is Swahili and English.
Right. So please, you understood that. Let me allow Ruth to ask the question. Ruth, please proceed.
Excuse me.
Yes.
Hello, excuse. We are asking our second question.
Are you hearing? Okay, I have a question on clients on DC. While we are DC, differentiated care.
Okay.
Okay, they are usually given 2 dates, of which the 2 dates are updated in Ushauri for date for refill and clinical review. My question goes like, when the client comes for refill and you try to book the client for the clinical review, it declines. So can you assist there?
Why are you booking for a clinical refill for a clinical review at the point of refill? Because the clinical review and the refill date are all captured when you are doing the appointment the first time. So when they are coming for drug pickup or the refill, you really don't need to make a new appointment, a new clinical review appointment, because it was already stated in the system. So for me, I think that is kind of like a duplication. But Ronald, you can expound more on that, even as we allow Ruth to proceed. Ronald?
I think you have well stated it, yeah.
Okay.
So you can't capture again the refill date once you had captured that. So if the client come for the next appointment, maybe which is the refill, you the clinical review, I mean, you just capture the next one, which is one.
All right, so let me allow Ruth. Ruth, please unmute and proceed. Ruth?
The first question is, I did not get to understand how I can view the web dashboard. If you can repeat that, please. And then the second question is about DSD. If a patient was not enrolled on DSD the first time, am I supposed to go back and update, or what happened?
Could you repeat your first question?
Yes.
Could you repeat your first question?
I'm asking, how am I able to access the dashboard? I did not get that. If you're able, kindly repeat.
Yeah, so I think for the dashboard, I'll answer, because for the dashboard, you only need to get to the internet on our web page, on our web browser, where you are able to log in to the website, into the Ushauri site, and you'll be able to see the client for your facility based on your login credentials. So you'll only be able to see the clients in your facility. So first, you must get login credentials for you to access the dashboard on a web browser. You need internet for that, so you have to be connected to the internet. For the DSD, I don't know, Ronald, if you'd want to take up that.
Okay, so I think for the DSD, you specify this based on when you are booking the client. Maybe I can reshare my screen. Let me just see if I can reshare again. Just a second. So what happens? You see, when now you want to confirm a client, like this client, at this point, it will ask you to specify whether the client is on DSD or not. So that's the point where we'll be capturing the client, and the system will now know this is a DSD client or not a DSD client. But if now you are enrolling the client to DSD, you will now go to DSD module and specify if it is a new client on DSD or continuing. Yeah, I think that answers you.
Thank you very much. Ruth, I hope you're satisfied.
Yes, I am.
All right. Stephen Gashigi, please unmute and proceed. Stephen?
I don't have anything. I think I'm okay. Is my hand up? I'm
Yes,
okay. It's accidental. Thank you.
All right. So I can't see any more hands other than the legacy hand. There is a question around who is supposed to give us the credentials to get access to the dashboards. Please, if you want to get to the to access the dashboard, first you need to reach out to the partner supporting your facility. They'll be able to assist you to really get access to the platform, to the dashboard. So you need to contact the partner that is supporting your facility for that. I don't know if There is any other question? If there are no further questions, I think time check, we are 4 minutes to 4. So at this point, I think I just want to kind of initiate the closer for this particular training. At this point, I think I want to invite Diana too, just to take us through the next session. Then we'll be closing. Thanks.
Thanks, Otieno. Thanks everyone for taking time to attend this training. So, and thanks the presenters for the day. That is Ronald and Victor, and also moderated by Otieno, the teams that were providing backup. We thank you so much. So maybe just a few comments. One is that we will be working very closely with NASCOP to support this particular application, not just one, but all our applications. Will be working closely with the team to spearhead this. And I'll be giving Songok an opportunity just to a few comments from the NASCOP side, how we are going to just partner together to ensure that the uptake of these solutions by all facilities is done. As we are aware, the mHealth solutions, Ushauri specifically, can be deployed in facilities that are offering care and treatment services, not only EMR sites. So this, so long as you have a care and treatment facility, these applications can be deployed in those sites. And for all the facilities that have EMR, we encourage the use of interoperability layer so that you don't have to duplicate some work. So when you have interoperability layer, it means that there's communication between EMR and also Ushauri, so then it will ease the work and of course avoid duplication. So we really encourage, we may need to do some work plans just to ensure that we have a plan after this training. The first step was just to do the training. Then the next step is just to scale up these applications to all care and treatment sites. I believe we have seen the benefits of these applications and we really want to tap into those benefits, but the only way is ensuring that we use these applications in our facilities so that we can also improve the quality of care that we are offering to our clients. So this activity, this training was necessitated by feedback from most of us. One of the things that came, we had a training needs assessment that we conducted, and one of the feedback is the low uptake of mHealth solutions in our facility. So this is just the first step. Today was just starting with Ushauri. We are planning to also have the trainings on mLab. We're also planning to have trainings on C4C, ART directory, and support you to ensure that these are rolled out in your facilities. If you think of any other question outside this meeting, just feel free to reach out to us. My colleague has posted in the chat the numbers for the service desk. So anytime you can just reach out to us. We will support you to ensure that you roll out these products. And if you encounter any challenge, we'll be on hand to support. So at this point, I'll welcome Songok to just say remarks from the NASCOP front. And also I'll ambush one of the partners just to give feedback on behalf of everyone. And the first person that I've seen from the chat, Otieno would be unmuting is Patrick Award. So Patrick, maybe after Songok, you can also give feedback on behalf of the partners as we close this. Songok.
Oh, thank you. Thank you, Diana. Just confirm if you can hear me.
Yes, yes.
All right, thanks. Good afternoon, all. I think I really do not want to belabor on what... sorry?
Just go.
Oh, yeah. So I really do not want to belabor on what Diana has mentioned. The reason as to why we we always strive to organize for some of these meetings or some of these trainings is to really make sure that we get updated and we improve on the quality of our documentation, and be able to ensure that we're able to track our patients very, very keenly and get the most up-to-date data from all our systems. So again, based on what you already know, most of these solutions were being supported by another partner, but currently all the solutions are being supported through Palladium, another Kenya HMIS3 project. And NASCOP is on the forefront to make sure that some of these solutions that have been developed are scaled up and are used, because at the end of the day, we really do not see the reason as to why these solutions are not being used in most of our EMR sites yet. These solutions are able to interoperate and be able to track and monitor our patients appropriately as it's supposed to be. So from us at NASCOP is just to appeal to all the partners, of course, working with the county, the use of the use of these solutions. And in case you have any challenges in the facilities you're supporting or in the counties you're supporting, please do not hesitate to reach out to us at Nation. We have Ushauri contact person. I think most of us, or probably most of us, may have met or you may have interacted with. That is a Shiko Ndekwa. She wasn't able to join us today because of other engagements, so kindly receive our apologies. But subsequently, we'll be organizing more of these trainings, more of these meetings, so that we're able to interact, and we'll always be available to ensure that all the challenges, all the gaps that you guys undergoing or facing in the facilities, we should be able to sort them out so that you are able to seamlessly use the apps and use all the solutions that we have developed through Palladium. So from me, I don't think I really have much to say. It's just to appreciate the team, appreciate everyone who was able to create time and join us for this particular training. Looking forward to more interactions, not only on Ushauri or these apps, but also generally the other interactions that we plan to have, the webinars for Kenya EMR, National Data Warehouse, and all the rest. Thanks, and back to you, Diana.
Yeah, thank you so much, Songoka, for joining the call, first of all, and also for your remarks. Maybe Patrick, I don't know if you can, in a position to represent the other partners. Patrick Owor, you can unmute and go ahead. Patrick, I don't know if you can hear me. Patrick Owor. Okay. Looks like Patrick is not with us. Right. So thank you, everyone. And Otieno will be giving us a schedule of the trainings that we have lined up in the coming weeks, so that we can plan to also attend those. Over to you.
Thank you very much, Diana, for those remarks, and thank you, Songoka, as well, for the remarks. So next week on Thursday, we are going to have a training on the mLab, C4C, and ART directory. We are combining the three because they are very short modules, so we'll be able to kind of go through all of them in 2 hours. So keep time next Thursday so that we can go through this. For this recording, we'll be uploading this on YouTube. So if at all there's anything that you missed during this particular training, feel free to log into our YouTube channel. You'll be getting this recording right there. And always remember to subscribe so that you can always get this and more in the YouTube. Otherwise, I want to take this opportunity to thank everyone who made it for this particular session. We appreciate your time. Join us again next Thursday for a similar training. For now, I think I'll just wish you a good evening, and God bless you. Thanks.
Thank you, and bye, everyone.
Thanks, everyone.